Hi, I'm Petru Manescu. I am running the AI for Biomedicine and Healthcare MSc program here in the Department of Computer Science at UCL. Machine learning and artificial intelligence are transforming healthcare perhaps in a more profound way than any other industry. And the demand for machine learning specialists with the skills and knowledge to tackle the current challenges in the healthcare is growing exponentially. But the complex nature of clinical science makes the employment of AI and machine learning in tackling medical problems extremely challenging. And this is where our course comes in. As well as equipping you with the foundational and technical training in AI, this program will show you how to apply it to biomedicine and healthcare. The course is aimed at students with a strong mathematical background, usually with a degree in computer science, mathematics, engineering, and related subjects. Now, why take this degree? Well, this degree will give you fundamental skills and knowledge to make a difference within the interdisciplinary biomedical and healthcare environments. All the lecturers in our program are experts in data science and machine learning, and they are actively involved in cutting-edge research related to AI, healthcare, and sustainable development. Now, I believe that biomedicine and healthcare are the most exciting field of AI to work in. Why is that? Well, AI has the potential not only to improve the current clinical pathways, but also to lead to scientific discoveries that will improve patient stratification and identification of personalized treatments. But AI in healthcare is not just about that. It is about building the backbone of efficient, effective, and sustainable healthcare systems worldwide. And this is where the uniqueness of this program comes from. Our program is structured as follows. You will have 6 core modules, taught modules, 2 optional taught modules, and 1 summer project. A project which is worth 1/3 of your total credits for this program. Let's talk about the core modules. So these core modules cover different fundamental aspects of machine learning and AI, from probability theory to advanced deep learning architectures. You will equally discover basic biomedical concepts and their relations to clinical pathways and the challenges in clinical decision support. You will learn about the different types of medical data, how they're acquired, their clinical applications, and the challenges that face machine learning practitioners. As I mentioned before, you have 2 optional modules in the second term. Usually they're taken in the second term, and they range from modules such as machine vision to bioinformatics or natural language processing. If you would like to know more about these optional modules, please check the online prospectus to get an up-to-date list of these modules. A big component of the course, as I mentioned before, is your project, and it counts for 1/3 of your credits. In practice, the project in our program starts in term 2 at the beginning of term 2, which is unique to other masters in our department. So it means that during one of the taught modules you will learn and write a literature review relevant to your project, as well as you will get your hands on the data of that project. And this will give you more time to explore in depth the analysis, the modeling during the summer period, where you actually dive in directly in building a model for your project. And again, this is, I will reiterate, this is a substantial part of your program. It counts for a third of the total credits. We offer a wide range of projects from areas such as medical image analysis, computational biology, or AI-driven solutions for global health challenges. You can opt for purely academic projects, projects in collaboration with clinical partners, but also projects with medtech, projects with industry, with startups or SMEs. In terms of careers, our students typically end up working in medtech. A recent example is Kaiko.ai, but also if you choose to pursue a PhD. Last year we've had 3 students who were offered a PhD in London on subjects related to AI and healthcare. What is the style of teaching in the module? Well, each module roughly consists of 20 to 40 hours of lectures and tutorials. The assessment is usually a mixture between courseworks, in-class assessments, or exams. But keep in mind that different modules have different patterns. We will also have seminars with invited guest speakers, and this is really great because you will have the opportunity to learn about the most recent developments in academic research and in the clinical adoption of AI. So with this is all I wanted to say. I hope you found this presentation useful, and I hope to see you in September. Take care.